I'm Dr. Felipe Martinez, professor of medicine at Córdoba National University in Argentina, and I'm a past president of the Argentinian Federation of Cardiology and the International Society of Cardiovascular Pharmacotherapy. Before answering which are the best drugs, let me say a couple of words about non-pharmacologic issues. For instance, it's very important to have a healthy life, a healthy diet, as natural as possible, to avoid cigarettes, to avoid narcotic drugs, to exercise, and to have the less stress possible in your life. So these non-pharmacologic issues are very important. And specifically talking about drugs, there are, in this moment, 3 different groups of drugs. The first one is the oldest, what we call inhibitors of the renin-aldosterone-angiotensin system. The main compounds in this group are AC inhibitors, an antagonist of the angiotensin receptor, an antagonist of the aldosterone receptor, now better known as mineralocorticoid receptor antagonists. The other group of drugs close related to the first one are the inhibitors of the sympathetic system, better called beta blockers. The other group of new drugs are what we call dual inhibitors. The acronym of this group is well known as ARNI, angiotensin receptor neprilysin inhibitors, because these drugs are acting in a dual inhibition of the angiotensin receptor and also the neprilysin, this new actor that produces a degradation of vasoactive peptides, and if you inhibit this product, you allow those peptides to have a longer median life in plasma, which is important to compensate the hyperactivation of the renin-angiotensin that happens in heart failure patients. These dual inhibitors has a new representative already in the market in most of the countries around the world, call it LZ-CYT696 in the US and in many other countries. The name is Entresto, and represents the first time that a new drug win the battle or was superior to the AC inhibitors that were the gold standard for the treatment of heart failure patients. We are working with this new type of medication, and the results are very provocative and also optimistic. Finally, there are another new group of drugs that are already in the market, but as hypoglycemic drugs for diabetic patients type 2. These drugs were being analyzed in diabetic patients, and 2 years ago, in an unexpected result, one of the drugs of this group, called empagliflozin, showed a surprising benefit preventing heart failure, hospitalization, and mortality. The result was so spectacular that many groups started investigating the other drugs of the same group. A second study, called CANVAS, with canagliflozin, almost replicate the same studies. In summary, we have a large spectrum of drugs to treat and prevent heart failure patients. Let me say some additional words about the glyphosines. Okay. The chemical name is also SGLT1 inhibitors, sodium glucose transporter receptor inhibitors. These drugs, as I said, are being used in diabetic patients. But after those two significant results published in the studies that I mentioned, now there are many programs investigating if this positive effect is also in the general population of patients with heart failures. It means not only diabetic patients, but just heart failure population, and if the result is the same, we are absolutely sure that this new group of drugs will represent a real excellent new tool for the treatment and prevention of heart failure. There are many potential mechanisms appearing in the literature trying to demonstrate that this new group of drugs is not only an hypoglycemic mechanism, but also they have many other benefits according to the regulation of the cardiovascular system. Therefore, if in heart failure patients those mechanisms are complicated or altered, the intervention could be of a real benefit for that group of patients. Regarding the second part of your question, are there new groups of drugs coming? The answer is yes, but among the long list, there are only a couple of them in the phase 3 of clinical research. It means before they demonstrate a real benefit and they ask for approval in the regulatory agencies around the world. I'm going to mention two of them. The first one are the myosin activators. The myosin activators are compounds that go directly to the myocardial cell, producing an improvement of their basic mechanisms of contraction to produce the cardiac function. This is a new concept. The main drug of the group is omencative, and it is a large phase 3 ongoing trial around the world. The second group in the pipeline, I said there are many, but these two groups are the most important, is vericiguat. Vericiguat is a compound that for different pathways produce an enhancement, an improvement of nitric oxide by the endothelial cells, which means a complete different mechanism to the inhibition of the renin-angiotensin system or the inhibition of the sympathetic activation in heart failure. And the initial results in phase 2 were optimistic, and therefore in this case there is also a large-scale trial around the world, and if the trial ends with a positive result, will represent a completely new approach in the treatment and prevention of heart failure.